Okay. All right, good afternoon, everyone, and welcome to the June meeting of the Working Group Victims of Sexual Exploitation, Violence, and Domestic Abuse with Baltimore County Government. My name is Henry Caligari. I'm the Senior Coordination Manager for Public Safety and Accountability here in the county. And before we get going into the bulk of this presentation, and folks don't mind introducing themselves, particularly since our video is kind of down. We'll start with people in person, and I'll turn to my right.
Good afternoon, everyone. I'm Delegate Jennifer White-Holland. I have the pleasure of representing the 10th Legislative District.
Good afternoon. My name is Maura Dunnigan. I'm the Chief of Staff for State Senator Charlotte Hendelman, District 11.
Hi, I'm Katie Curran O'Malley, and I'm the Executive Director at the Women's Law Center right across the street.
I'm Kelly LaValle. I'm Executive Secretary for the Police Accountability Board and many other that Henry runs.
Hi, everyone. My name is Chanela Osakwe. I am the policy analyst on the DC SWAT team.
Good afternoon, everyone. I'm Adam Rosenberg. I'm the Vice President of Violence Intervention and Prevention at LifeBridge Health and the Executive Director of the Center for Hope. And pleased to introduce our new manager of our DOVE program, Elizabeth.
I'm Elizabeth Bloomfeld, and as of Monday, I will be the manager of the DOVE program at Northwest Hospital.
Congratulations.
Amanda Rodriguez, I'm the CEO of Turnaround.
Scott Schellenberger, State Attorney's Office, and I'm right across the courtyard.
Chief Rob McCullough, Chief of Police. Ernie Wrights from the Office of Law. I'm the legal advisor to the Brian Group Executive for National Captain.
Lindsay Wesley, Data Fellow with BC Staff.
All right, and I don't know the best way to go about it. I never know in these meetings the order of operations for folks who are on WebEx, but people just don't mind unmuting and taking turns as best as possible introducing themselves.
Yep. Hi, everybody. This is Mark Millspaw. I'm the Director for the Department of Social Services for Baltimore County.
Hi, this is Alicia Bickoff. I'm the Deputy Director of HANA.
Hi, I'm Lisa Nitch. I'm the Chief Operating Officer for House of Ruth, Maryland.
Rebecca Allen, Victim Services Unit at the Governor's Office of Crime Prevention and Policy.
And so we also have Amy Blank, who's on the Baltimore County Commission for Women as well. All right, so now turning to the focus of today's meeting. Over the last several months, we've been working with the Baltimore County Police Department and with BC Stat to do a deep dive and analysis of calls for service and victims and arrestees of domestic violence in Baltimore County. Based on the first few meetings we've had, there's been a lot of good conversation about the challenges that we face in our county, what resources are available, what areas are emerging as challenges, trends that are coming up over the last several years. But based on those conversations, the internal discussion was to try to look at the data and look at the numbers and to provide some support for the discussion we've had over the last several months. So the department was very generous, quite frankly, with providing the time and energy and resources to do a deep dive into DV data that they're seeing. And the team at BC Stat did a tremendously good job at taking that data and putting it into this presentation so it's in a digestible format. And I really want to thank Captain Michaud and Lindsay Mosley from BC Stat for taking the lead on this, but also for the rest of the BC Stat and BC PD team as well. So without further ado, we'll jump right in. And looking at an outline for the rest of this presentation, we're looking at the types of offenses that were captured in the data that was provided, calls for service, data on victims and arrestees, an overview of the various precincts in Baltimore County and some information there about population, what areas they cover, mapped out rates of domestic violence incidents by precinct population, and then a snapshot of each of the precincts. And by the way, if anyone has any questions, please feel free to jump in, and we got plenty of folks here who can help answer any of them. So I want to start by, actually, Kelly, could you pass out the handout for this section? The domestic offenses that were captured in this data, which is not a exhaustive list of any and all crimes that could be considered domestic offenses. Obviously, that's going to be almost any offense that occurs in a domestic setting situation, but these are the ones that are there. Kelly's passing out a handout, which we made available to those who are online, that goes over the definitions. And I think it would be worthwhile, Captain, if you don't mind mentioning how NIBRS records the various and how that process works out in various charges.
So things are a little more complex because we're dealing with Baltimore County, we're dealing with the Maryland law, and then we're dealing with NIBRS, which is how we report it, the FBI, crimes. So with NIBRS, there's a little checkbox, so the officer takes a report. If it's domestic related, according to NIBRS, they have to check yes, and then fill in the relationship. There's like a list of 15 relationships, so it could be roommates, cousins, aunts, uncles, grandkids. That's totally different than when we make an arrest based on a Maryland law. So if they're living together, or if they're married, they can even be married and separated, we can still make an arrest if there's injury. So it's a little more complex than just black and white, yes and no.
It can help if you don't mind sitting up here just so that the microphones capture everything. We don't miss it. So again, there's a list of what appears in this data. Again, it's not it's not limited to these offenses, but these are the ones that came up in the data. So turning now to this slide, the DV related calls for service. We looked at 2021, 2022, and 2023. So really post-pandemic numbers in relation to calls for service. And this chart includes calls where a domestic situation or scene was found, whether or not the call originated with a domestic violence call type. So this includes calls where somebody called because their neighbors were loud and the police arrived and determined that it was a domestic violence situation. But then, of course, also those where there was a call specifically for DV service requested. So when you look at the chart, the top line is all service call or all calls, which you can see a slight downtick over the last 3 years, going from 3,300 in 2021 to just under 3,000 in 2023. And you can also see that tick is, or that trend is reflected in the non-DV and DV calls. So that's the sort of overall picture where law enforcement officers are being called to a scene for domestic violence or not, and they are finding it, and where a report was written as well. So that is kind of the universe that we're working with here. The next slide is reflecting these numbers by precinct. So as you can see, the downward trend lines are reflected in most precincts, but you can also see that, and we'll get into the raw numbers more later in the presentation, but you can see that the numbers, the highest precincts for DV related call for service, where scenes found, situations found, are Essex, Dundalk, and then in third, Woodlawn. The chart here running from basically 100 to at least 700 is on the top line. And there are some that had percentage rate increases over this period of time. Franklin had a spike in 2022. Coxville had a spike in 2023, although their raw numbers were lower. But this kind of gives a general idea of the trends we've seen by precinct in Baltimore County. So looking at the overview here of victims and arrestees, the number of DV victims has been decreasing slightly for the last few years. The number of arrestees increased in 2022 and then decreased in 2023. So if you look at 2021, there were 7,547 victims, and that number has fallen by approximately 1% each of the last 2 years. And then if you look at arrestees, the number spiked in 2022 and came back down to a figure that was lower than 2021 in 2023. So those are countywide numbers. All right, so looking at victim case counts here, as you can see, the vast majority of the crime, so to speak, is assault. That is the overwhelming majority of cases over the last 3 years. 93% of DV victim cases each year are assault offenses. That includes the various degrees of assault and the specific, I want to say, different categories within that as well. So those were clumped together here for the purposes of, again, making it more digestible instead of breaking it down into each category. Likewise, we did separate out child abuse assault cases. So those are the second largest grouping of cases. And then below that can be sexual assault, vulnerable adult assault, arson, threat, and child abuse sex offenses. And again, the numbers there are interesting because while there was a downward trend in total cases, the assault numbers are fairly stagnant over the last 3 years, with a slight increase in 2022, and then essentially a decrease to a very similar number to 2021 in 2023. But in looking at sexual assaults, vulnerable adult assault, child abuse, sex offense, those cases are in a downward trend. Child abuse assault has increased a little bit in terms of victim numbers as well. But the vast majority of these cases fall under the assault category. And the totals here include counts of cases with single offenses only. Those that were listed as multiple offenses, the numbers are fairly low. So you can see in the bottom right corner, there were 9 multiple offenses listed in 2021, 5 in 2022, and 6 in 2023. Captain, I don't know if you want to give a little explanation as to how that plays out.
That's a little more complex too, but when we're writing a report, we typically only capture one crime. So when we put offense, it'll be one crime. So somehow they slip through the cracks, and there might be an assault and a kidnapping, or an assault and a robbery, even though it's domestic related. So that's where the multiple offenses come in. So just because we capture it as one doesn't mean they're not getting charged with 5 or 6 other crimes.
All right, so similarly to the overall numbers, this is the victim case count by precinct. Again, you can see that the 2 highest precincts here are Essex and Dundalk, with Woodlawn in third, and then the other precincts clump somewhat around each other. And again, I think this is really useful data to look at trend lines per precinct for victims. And again, it's only 3 years of data, but I think it still gives a good picture of where we are post-pandemic, where Essex and Dundalk both saw a 7% decrease in between 2021 and 2022. There was an increase in Dundalk and no change in Essex, and there was no change likewise in Woodlawn, which did see an increase in 21 and 22. Franklin had a 12% increase, then 11% decrease. And again, that's kind of the nature of a lot of these numbers when you're talking about case types where it's in the hundreds and not in the thousands or higher. A relatively small increase or decrease can represent a significant percentage increase. You see that with Cockeysville at the bottom, which has the fewest number of victims per year of any precincts, but even a slight increase in raw number increases it by 25%. All right, so now looking at the arrestee numbers. So the prior numbers were for victims. These numbers reflect arrestees. So here, again, similar to the victims, where there was about 93% of the DV victim cases were assaults, 94% of DV arrestee cases are assaults. And again, here, the categories are grouped together. So assault, slight increase in 2022, and then back down to the number it was actually in 2021. For 23, arson numbers pretty consistent, sexual assault numbers pretty consistent. There has been a decrease in child abuse, sex offense arrestees, although those numbers are still below 20 for each year. Okay. Looking at the precinct data, again, here you see some more, I would say, more rapid change than you see in the victim numbers. For instance, Woodlawn moving into number 2 in 2022, and then Dundalk jumping over it in 2023, Essex at number 1, and looking at the other ones below that. So you can see that Essex has had year over year 3% and 3%. Dundalk was down and then spiked back up. And again, looking at, for instance, Parkville saw a market decrease.
There's a question, Henry.
Yes, so this is a question from Director Millspaw. Do we have a general sense of how this compares to other jurisdictions in Maryland? We have not had the opportunity to look at this level of data and other precinct or other jurisdictions in Maryland. I think that would be a useful exercise. I'm not sure how willing those other departments are going to be to share their data with us to this level, but it's certainly something to think about. And also, I mean, one thing that in talking to the department, very clear, we have a uniquely large police department in terms of the number of precincts and the geographic areas that we deal with compared to other jurisdictions, which often have city or town or police departments that are going to handle some of those cases. All right, so this is a map that overviews the precincts and many of the providers in Baltimore County. So again, the colors that are on the screen reflect the general population of each precinct because they're not identical. The largest precinct is actually by population, Cockeysville, which has some of the lowest numbers of DV-related offenses or cases as reflected in this data. It's got 98,000 approximately, Dundalk, 75,000 people, Essex, 91,000, Franklin, 95,000, Parkville, about 74,000, Pikesville, 77,000, Towson at 74,000, White Mark at 79,000, Wilkins at 80, and actually in Woodlawn's largest here, sorry, 107,000 people. So the numbers are not going to be even per precinct. I think that's important to keep in context. We look at the data that breaks down each precinct and the numbers that are coming out of it, because we're not talking about the same number of people served. And obviously, there are going to be significant differences as far as the just the makeup of each of these precincts from simply a density standpoint, a geographic standpoint, where they are in relation to major population centers in the precinct. I mean, Cockeysville, that's a geographically huge precinct, but we know its population is centered along the York Road corridor, and specifically close to the Towson precinct. So that's something to keep in mind as we look at this data a little more in depth. So now service calls and their rate for precincts. So Lindsay, if you could just give a brief explanation as to how we arrived at the rate figures, just so there's no confusion there.
Sure. So all of the rates are based on the 2022 census population. So we took the population per census tract in 2022 and joined that spatially with the police precincts. So to actually get these rates for service calls, we've got service calls, just the count divided by the population and then times 10,000. So this is the rate of service calls per 10,000 residents per police precinct.
Great. I think that's a really useful way to look at it, because as we just saw, the numbers are going to vary dramatically. So breaking it down to a single rate, I think can provide a better indication of the level and the volume of cases per precinct here. And as you can see here, Dundalk and Essex, both in terms of raw numbers and in rate, are coming out of the highest. But it does show that White Marsh, which does not have the same raw numbers, has a higher rate than Woodlawn, which has, again, a higher raw number of cases because it's a larger precinct. So this is a useful way to kind of look at where these cases are centered and looking at by population, the frequency for service calls here. The next slide is the victim case count using that same rate description that Lindsay just went over. And again, here we see Dundalk, Essex, and Woodlawn with White Marsh right behind that in terms of the rate of victims per 10,000 residents. And we can also see that, again, with Dundalk, there's that slight decrease, a decrease and a slight increase, and with Essex, a decrease that leveled off between 22 and 23. And if anybody wants me to slow down, if you want to take a look at this, I'm happy to do so. Next slide, similarly, this is the arrestee case count per 10,000 residents. That is somewhat similar to the rates are going to be lower, obviously, but the number of the rankings rather of the top three precincts are similar. So again, talking about Dundalk and Essex, followed by Woodlawn, and then in this case, Towson and White Marsh being close fourth and fifth position, relatively speaking. So the remaining slides are going to look at each precinct, which includes the DB related service call counts by call type, the victim case counts by offense, the arrestee case counts by offense. And again, these are the single offense cases only, which represent the vast majority of how this data is captured. First off, looking at the Wilkins precinct. Now, something to note here is that the axes, the y-axes, are going to be different based on each of these precincts. So if you look at just the trend lines out of context, it's not going to necessarily give you an accurate depiction, because here the cases top out at 166 domestic violence related service calls. It'll be higher in other precincts and lower in others. So just keep that in mind when you're looking through these slides. But again, you can see here the trend lines for each of these precincts, and the fact that the vast majority of these cases are categorized under the broad category of assaults. I'm turning to Woodlawn, the next one here. And again, if anyone has any precinct specific questions, feel free to jump in here. And with Woodlawn, you can see the number of non-DV calls, for instance, falling pretty quickly for each year, but number of DV calls actually increased in 2023. Similar story with Franklin, where there was a significant spike in 2022, followed by a significant decrease.
Ms. Bickhoff has a question.
Yes, feel free to unmute.
Hi, is there any indicator about the severity of the crimes? Because I'm just thinking about, second degree assault is such a all-encompassing and broad charge, but, not all assaults are the same.
Yeah, and I think that's one of the things that data is not going to capture perfectly, because as you just said, if it's a second degree assault, or really even first degree, it's not something where it's easy to capture what level of harm was done to the victim. Was it a situation where the victim suffered a serious injury or not? It's not going to be well captured in this data. So again, I think that this conversation in a lot of ways is a starting point. This data is a good point to kind of jump off from, and then to look at when we're talking about solutions, or again, the resource allocation to various, again, where are we putting the resources? Those are things that I think will come more from the experience of the providers and what you all are seeing on the ground, and hearing from the people who are receiving your services. The survivors who are receiving the services can better speak to that, I think, than often the numbers can. I think it's a great question. Looking over at Pikesville again, this is a good example of why support over the y-axis is going to be different in precinct, because it looks like a very sharp decrease and a very sharp increase, but we're talking about going from 129 to 108 back to 115. So percentage wise, it is a significant change, but as a raw number, it's again, 7 case increase, or 7 non-DV call increase between 22 and 23. And looking at Towson, again, you can see that pretty quick decrease in the number of DV call cases. We'll return to, and then Cockeysville, where you see one of the more unique standouts in this data set is the increase in non-DV call cases, where it actually surpasses the DV calls but again, because the axis is fairly small here, 30 is significant, but it is only, I don't want to say only 30, but it goes from 57 to 87, which again is a big jump relative to the case numbers in the Cockeysville precinct, but is not a huge shift in some of the other precincts. Looking over at Parkville again, you can see that there was a fairly, again, quick decrease in the non-DV call cases where there was a domestic violence taken down. White Marsh. And for those who are on WebEx, this PowerPoint will be shared for those who are remote as well. and then asterisks. And so here, again, the numbers, the raw numbers are significantly higher than they are in other precincts. Again, 21 non-DV call drop looks somewhat flatter here than it would in other precincts, but it's important to keep that in mind just again, if we keep going through these. And finally, we have the Dundalk precinct where the numbers actually flattened out between 22 and 23 for non-DV calls. All right, so I think the bulk of this conversation today that I think would be useful is a discussion and any thoughts or questions about this data. I think that, again, I want to thank BCPD and BC staff for all their help with this, because I do think this is, again, a really important jumping off point for a further conversation in terms of looking at what we are seeing internally to the department and how a lot of the initial interactions for people who are survivors of domestic violence are going to start. They're going to start with somebody, whether it's themselves or a neighbor or family member, calling 911, having law enforcement arrive. Then very often they will end up with a provider in terms of finding services. So I want to open it up to people in this room to discuss. And again, whether there's any questions you have or any further discussion, and I can jump around if people have specific questions about each of the different precincts or the data in general. I see Director Mills-Fogg raise his hand.
I just have a question that I want to make sure I'm understanding the data accurately. Baltimore County has pretty significantly expanded its crisis response capabilities. We added a new team a few years ago. I just want to make sure that the declines that we're seeing in this, year over year data aren't because calls that used to be logged as a law enforcement response are now being excluded as a law enforcement response because they're getting a crisis response. I don't think that's true, but I just want to be careful to make sure we're understanding that.
That's correct. If it's the crime is going to supersede the crisis response. So if crisis does respond, you're still writing the crime. The crime still occurred. So they're captured here under what we call B14s and 15s, which are domestics. So if there is a crisis component to that, that will be separate from that.
Alicia?
Is there any information, and this might be something for the future, about the demographics of the callers? Because I'm thinking about communities like that. This data is really, really helpful with respect to seeing, those who engage with law enforcement, but I'm thinking about communities who don't engage with law enforcement. And I'm also thinking about, there is the crime of abuse of a vulnerable adult, but I'm thinking about those older adults who don't meet the statutory definition of vulnerable. So it'd be really nice to see, crimes committed against older adults as well.
Yes, we didn't do a demographic breakdown of these, which I think is a more intensive project, I think, would take. I don't know if that's accurate, but and then that was our discussion was to initially, at least with this first presentation, to provide the bigger picture. And obviously, you don't want to draw too many inferences from each of these precincts in terms of what the demographics in those precincts look like, because again, you're going to have variations and distinctions within those communities. So, but I do think that's a good question. I don't know, Captain, if you could speak to that as well.
I mean, that has to be data that's described that exists because there's a tab for it. But keep in mind that this is not all the vulnerable adults. These are just domestic related vulnerable adults. So that's not capturing nursing homes, group homes. It's with a domestic related element. So that's probably a separate discussion.
Yeah. No, I think that is very helpful. And I think, again, more broadly speaking, the question of I don't want to say the limits of data, but the inherent nature of data is that it doesn't tell in and of itself a story. Yeah, it's a straightforward, okay, here's the number of cases, here are the rates and here are how they've changed. But even then, it's difficult to establish if there's a change in one precinct. For instance, the increase in Cockeysville, what factors are coming into play there? And I think there's innumerable ones. But the hope is that using this data as a starting point, we can begin to look at and get some more information as to where the greatest need is and where the greatest demand is for these services. Senator Millspaw said our TU and UMBC data included Towson Precinct and Wilkins respectively. It was a DV related call and let's start with that.
We don't have, they do their own reporting on everything except for acuity part one.
Right.
And then we would capture that. It would be up in the great network.
So it would be predominantly handled by their departments. And the last meeting, TU spoke to some of the challenges that they've had with the length of the process they have internally, and the fact that it is sort of this unique area where they do have their own departments, but they also have the fact that students are on campus in many cases, or in the campus area, and figuring out the logistics of best practices there, making sure the process is, again, respectful of the students, but also the fact that in some cases these involve legal matters that go beyond just what the Title IX coordinator can address.
And Henry, is the location where the incident occurred or where the victim resides?
It's a good question. So it's going to be where the incident occurred. Got it.
I have two questions. So the first is not a question, it's a statement. There's somewhat confirmation that it was really helpful because our numbers are similar where we've seen kind of this plateau. It increased greatly during COVID and now we're kind of seeing the same. And from what I'm hearing in other jurisdictions, it's not similar. A lot of other counties are starting to see the decrease, but seeing the heightened level of violence within their community. So more strangulations, more high lethality. So it's interesting that we have not seen that in Baltimore County. That's not the question. I have two questions on top of that. Sorry.
That's fine.
The first is around LAP. I mean, I think that in terms of the way the county was originally broken up for LAP, it doesn't make sense now looking at the data, or at least we have the 3 LAP providers here. It seems very heavily concentrated on the east side of the county. So that may be worth conversation or looking at a future date. Also statement, not a question. Sorry about that. I do have a question now. On the slide about, I guess it was 2 different slides, we're talking about offenses and incidents and then arrest data. Is there can we look at statistically the difference between the different categories of crime? There were a couple that stood out to me that clearly the level or the number of offenses versus the number of arrests was significantly lower. And I love information as to why that seems to be the case.
Yeah. See here, so this is the arrestee count numbers, and then
So we're looking at, and with assault, it makes a little bit more sense because I know that your police are not necessarily going to arrest for an assault because of the type of crime that it is. But for like sexual assaults, we're going from 105 to 20. There were 80 incidents of sexual assault that were not the abusive partner or the person in the home was not arrested. But if the assault, I'm assuming the assault data is that much lower because of the type of crime that assault is, because it's a misdemeanor. But if that's not the case, I think it would be helpful to understand why more people are not getting arrested.
So these assaults actually include first and second degree, so felony and misdemeanor. And like, I know we talked about the injury earlier, how severe is the injury, but we're making an arrest if a husband pulls a knife on a wife and doesn't cut her. That's first degree assault. So that arrests the felony, even though she's not injured. Same with the gun. If a gun gets pointed, somebody's getting arrested. So it also includes the new strangulation. So if they say they were strangled, they're getting arrested because it's first degree assault, even though there may be no evidence of injury. It rises to the level. Jumping down to the sexual assault and the child abuse assault, those are all staff of the state's attorney. So it's a meeting between them, who gets charged, who doesn't. And with the sexual assaults, everything's victim centered. So the victim, well, the victim kind of runs the investigation. So if it's the wife that doesn't, the husband's the breadwinner and she doesn't want to prosecute, that's not going to be her.
I think it might, again, because of the nature of what this group is supposed to do, I think it's probably worthy of further just conversation about, because it's just significantly different in terms of the offenses that are being reported and those that are being arrested. It would be great to look at prosecution data to see how many of those that are getting arrested are then prosecuted at what level.
And that is one of the next steps. In the state attorney's office has been very generous and shared data. We do need some updates from it just based on timing of this meeting and then future ones, but Schellenberger seems to be very, very helpful in getting that process going. I wanted to, coming up with this somewhat sequester the two topics, because there is, I think, a lot here to break down. There'll be a lot there to break down, and sort of a different, one of the good things about the precinct model is that it allows for somewhat of a geographic conversation versus more of a countywide where we're doing conversation. But because I think it is useful to look at, partially just because of the way that Baltimore County is unique, in the number of, and the geography of the precincts, but also the number of providers. We have a significant number of providers in Baltimore County who service different areas. And I think it's useful to kind of look at where many of these cases are originating. Obviously, not all of them. There's going to be a significant number where it doesn't begin with a call for service, but it's still going to be a significant chunk of these that originate at that level.
And I think the last thing I'll throw in, I'm sorry, now I'm at like third question for statement, but my goal would be to ensure that every single person represented in the offense count is getting access to services. So maybe looking at that process would be helpful as well, just to make sure that we're not potentially missing people simply because they don't rise to the level of arrest or something else.
Sure. And I do think that's kind of the next big question, right? Is how are we, and I want to be open, we received a tremendous amount of data from many of the providers, I believe all in this room. And so that's part of the next step, is taking a look at that and finding the best way to bring that into the discussion. Because that's the other major side of it. It's a three-legged stool. We have the police interaction, the prosecution piece of it, and then almost the everything else side of it, which is namely going to be the provision of services to these survivors and making sure that the survivors who are reflected in these numbers and also those who don't call police are going to be able to access the services that are in demand. So I also do want to thank the providers for sharing your data, which I understand is in a lot of cases quite a bit of work to put together in the first place to make it digestible as well. So. Any other thoughts or comments or discussion? And I think we can also take this into a discussion about next step as well, and not just what is here, but also what isn't here and what you all would like to, where you would like to take this data. If anywhere, we have some good thoughts about looking at, again, the provision of services to those who are reflected in these victim case counts, to look at, again, the discussion of severity and potentially demographics, but
What also makes me, and I appreciate the overlay of the various providers and where they're situated. It also brings about thoughts about resource allocation, where we need to make investment based on the precinct data. It also makes me wonder, just even from what does a preventative strategy look like, where we might be able to focus on Essex, Dundalk, and Woodlawn in particular, given the data we've seen. But what are the unique factors that make those three precincts stand out in comparison to the others? Like, I think that what I would say would be helpful is to take a deeper dive into what makes each of these data points distinct, which I think will better help us to pinpoint what are the unique strategies that we may have to employ through resources, through provider collaboration, connections, and also the other services that may be within community. again, I think that there's more here that we can take a deeper dive into to really kind of get a better sense of what is uniquely happening in these localities and what are the social and structural conditions that are, if anything, resulting in the data we're seeing.
Yes.
So the Essex Dundalk corridor is my corridor, Shelby from the Family Crisis Center. And I recommend, so I'll put it there, playing with poverty. You gotta look at the population that you're dealing with in that sector of the county. Lower income, a lot, that's basically the issue there. High stress attention in the home because of these things. So that's one of the main, if not the main thing, looking at that population specifically.
And to just overlay that with the conversation, one of the first conversations we had about housing too, is that if you're a lower income individual who's a victim, survivor of domestic violence, it's going to be even more difficult to access affordable housing solutions in your community. It may not be an option to move, may not have an option to find a place that is, I don't mean this in a way to minimize it, but if someone who has means to find another apartment in your community relatively quickly versus those who don't. That's a different set of challenges for those individuals. And I know that it's also useful, the data dashboards that the county has for other instances, particularly criminal instances. There's unfortunately a lot of overlap between what we're seeing with this data and where you're seeing high preponderance of other issues, whether that be 911 calls in general, whether that be overdoses. There's a high correlation between those and what we're seeing with the domestic violence data.
So I was just saying that more as it relates to social determinants, because I think we all know that there are these intersections that do exist. And it's beyond looking at this, being hyper-focused on this, but also addressing what are the other issues and conditions that we need to create to promote health, well-being that can also lead to, a reduction and, if anything, prevent these types of stressful situations from happening. So I was just saying it more from that to call it out, because again, I think there are some other opportunities at a macro level that we have to also ensure that we're looking at these things from that level.
You also can't ignore the historic aspect. As a prosecutor in, I hate to say this, 1987, I was in Essex District Court, Dundalk District Court that existed then, and Catonsville District Court, and that's what you saw. And that was 30-some years ago. So there is I think the word historic, that makes it sound good. There's a system that is built into it with all these other things that everybody else has meant. I mean, I hate to say it, but it's been like that in those three places for a very long time, right? You're like 10 years after me, maybe more.
A little bit after, yeah. I know it's always been very busy courthouse, not just with the domestic violence crimes, but as you know, and Amanda probably was too, and those were the busiest dockets. Especially the summons docket. You remember the summons docket? I don't think that exists anymore, but that was just, you would have everything, but you would get a good fair amount of domestic violence victims, and it was there for hours. And I sat as a judge in Essex, and it is definitely the busiest when it comes to domestic violence. We have a lot of language barriers in these for the different Spanish communities and communities.
And unfortunately, Juliana wasn't able to attend today, although I want to make sure to get her thoughts and circulate those around this meeting too, because incidentally, you also have a very large migrant population that lives in somewhere between the Dundalk, White Marsh, Essex precincts, and as well as White Marsh, Parkville to an extent, and then the Southwest. So you have different questions about what was discussed in the first meeting. One of the challenges is the cultural differences and distinctions about what rises to the level of domestic violence. When does the conversation shift to getting law enforcement involved, and how there are differences and distinctions. I mean, and that's even within the non-migrant population as well. So I think that is another part of it too, in how often individuals feel comfortable bringing law enforcement into the equation is going to affect these numbers, maybe not at a massive level, but it will have an impact at a certain level.
Is it possible to see the high lethality data as well? Just because I remember looking at this, and I think it was last year, similar data set on Baltimore County, and the highest lethality cases were actually in the Wilkins precinct, and the highest murder rates, which I know the numbers are very low for related homicide, but it would be interesting. Again, we're talking about resource allocation. If we're seeing high lethality in the Wilkins precinct, maybe something to look at as well. And then on the note around the immigrant population, which I'm really glad you brought up, Henry, when we pulled our data 21234, which is Parkville, was by far the highest rate of all of the services that we provide was centralized in that zip code. And a lot of it is the immigrant population, who I don't think we're calling law enforcement.
Right, it's a whole other conversation too, the legal status of of both people, the perpetrator and the survivor. It's gonna have an impact. Yes, of course.
Part of your work, the police, so, you know, in talking about the services, one of the services obviously that is for protective orders, and having people come to get a protective order, having them come to the different district courts in Baltimore County, because Essex, Claytonville, Towson, and the circuit court does them as well. Circuit court gets service on those protective orders pretty quickly. It's all done through the sheriff's office. They do the warrant checks, they do all that, and then 2 sheriffs go to serve a protective order. Because these are some of the most dangerous, for the police to tell you, the most dangerous times for police to go into a situation where there's domestic violence, especially when the parties are both together. But you're not seeing service in the district courts. I mean, it's so many cases are put on waiver, and I mean, I've been following one case specifically, and it's just I don't know the situations. And I've talked to a few of the police, and they said, well, some of it's to do with the clerk's office, the district court. So some of it has to do with the district court and how the clerks are notifying the police. And then there's obviously 10 different precincts, so the orders go out to 10 different precincts. And then a patrol officer, as I understand it, and tell me if I'm wrong, is responsible then for serving that in between the calls. So, you know, if it's a really hectic day or night, they may not get a chance to do it. And that the midnight shift officers are not serving. So like at midnight, that those officers aren't serving them, which would seem almost certainly would be dangerous because you're waking people up and you're getting them startled and whatnot, but most likely the person would be home if they had not been necessarily evading service. So, because that's one of the main things that we do along with custody, divorce, and whatnot is the protective orders, and we just can't get service.
Yes.
So, and I'm just thinking it's a disaster about to happen because you're gonna have some horrible case where a petitioner came and got a protective order, some judge granted it, and it just never got served, and you find out that, you know, the person was never ordered to vacate, they were in the house, they were never ordered to, you know, to surrender a firearm, they murdered somebody, and then you get Jane Miller all over it. I mean, it's usually the kind of things that keep me up at night.
A lot of factors there. Even when the petitioner goes and gives the wrong address, that slows up the process.
Sure.
Yeah, giving it to the postcard who gets a robbery right now, roll call, slows up the process.
Is there something that can be done, like between the clerk's office and the police, just or to somehow streamline it better? I mean, it just seems in this day and age, they're
The process.
right.
Yeah, because they're picked up, I know they're picked up every day. They're in the mailroom. And look at, I personally might be stepping out, serving here with the chief, but I'd love for the sheriff to serve them all.
That's what they do in the city, and that's because, and that happened about a decade ago. The Baltimore City Police were supposed to be serving. They couldn't because they were just too busy. They just had too much to do on top of serving.
It's a lot going on.
So the sheriff, which was mostly doing the evictions and postings and things like that, had the manpower, girl power, you know, person power to do it, and they took over service, and it was a game changer. So, I mean, I don't think Jake Fisher would really appreciate somebody coming in.
Currently, he doesn't have the people power.
He doesn't, yeah, that, and I think the law enforcement now, in all the agencies, you have, yeah, have issues with.
Or you guys are short, and then Jay's short. Short there.
And we did actually, the last meeting, and we can circulate that, the presentation on the service of correct orders. But it was, again, it reflects a lot of the same conversation about the challenges inherent in service when the individual responsible for open service is also doing everything else in the police realm and the limits. And then also, as Captain Show said, the challenges of every step along the way, there can be issues, right? If the address is incorrect, or if the clerk's office puts in the wrong address by accident, it's a one letter they're staying. There's a lot of address issues before evasion even kicks into it, because then you've got the other issue if you got a person who no one may know where they are.
Sometimes we'll even have a situation where the person's in jail because they have a corresponding criminal case. And then we'll be like, hey, we've got this respondent who's also got a bail review tomorrow and may or may not get released, but if he gets released, we're never gonna find him when you please serve. And it's not happening.
That should be. That happened when I was a shift commander. As soon as it came in, it was in the jail. Because the cop thing started.
So then
Well,
somebody
we
has-
or serve them in the back when we get the house.
That way, if we do get released on that bail review, boom, we got notice, they should show up, fine. If they don't, great, we'll just do a default, but I don't know, it just says one of the things.
Katie, if you know of specific instances where that occurred and want to shoot me an email, I'd be happy to kind of look and debrief and see kind of what happened and
Sure.
see if there isn't something that's easily fixable, and put eyes.
Thanks.
I'll give you my plug.
Okay.
So Alicia had her hand up.
Yeah, just to continue on like your ears must be burning because I'm literally like responding to our legal advocate who's saying I'm about to sign off for the day, but I just have to find out if this respondent for our case on Monday has been served or not, and we can't figure out whether he's been served or not. Like literally, as we're having this conversation, this is directly happening with one of our clients. So I think I would be remiss if I didn't raise the issue that it's not only an issue of whether service is actually being effectuated, but then also on top of it, is that being communicated to the court and is it being communicated to the petitioner in the case? Because there's been on top of yes, there's been plenty of problems with actually effectuating service, don't get me wrong. But also for a victim to not know whether service has been effectuated or not, it completely changes their safety plan. It completely changes their actions. It changes their approach and how they prepare for court or not on the very next day. And I think that we have many clients who register with Vine VPO. But I know that there's been tons and tons of problems with Vine VPO as well. So if we're really going to address this issue, I think it's just important to address all components of it.
I think that's a really good point too, is that, and I mean, just speaking from personal experience, when I was in private practice, I represented a lot of complainants, and it's easier for me as an attorney to get that information, but on the same docket, you have a lot of folks who are 100% and they have been there their second or third time, and they're, it's a burden for them too, because they need to. It's tough too, because again, you need to make sure they have reliable contact info, and the courts can get that information and send that out. So I agree, that's kind of the other piece of this, in addition to the arrestee side of it, is the non-matters that are in the respective orders. So. Director Millspot, were you jumping in or? Okay, sorry. Other thoughts, or, I mean, I'd also be interested in hearing what folks would like to see as far as next steps. And we've mentioned some of them, but with this data and also looking ahead to the next meeting I think we'll probably end up in early September. I think August is logistically going to be really difficult to find time where everyone's going to be, or the vast majority of folks will be available. I know a lot of people are going to be out of town then, and want to make the most of these meetings. July is equally a challenge, but we have the benefit of an awesome BC stat team. So data side of it, I mean, I think speaking for myself, I think this is that Lindsay did an excellent job with this because I'm not a raw numbers person. I'm a visual person, and being able to look at the precinct data, I think is a huge, it pops out in a way that seeing numbers on a chart doesn't.
Yeah,
Yes.
Henry, I think if it's possible, I'd like to see where victims reside versus where they've been, where the crime occurred. Because I think that speaks to some ways about where ongoing services need to take place, access to therapy, access to case management. It's more than likely probably around, where these cases occurred, but I think there is some, around perhaps around the more, busier cluster, centers of the county there.
I would imagine it's probably pretty much.
And I don't know if you can do it by precinct or if you have the ability to do it by zip code too, because that may also give you a sense that you have, I think to Amanda's point earlier, you've got immigrant populations that aren't necessarily being served, and it would just give a different sense as to where we could perhaps deploy resources differently in communities and neighborhoods.
It's going to be tougher. Yeah, I think that the check doing the breakdown there would be.
Because you in theory could have them residing in the city, but just come out here to pick up a kid and they.
Sure, and that's probably the most complex when they cross jurisdiction, right?
Right. Or staying.
Philip, it'd be interesting to see that too, by the way. If X% of these cases took place outside the jurisdiction, whether it's in the city or Harford County, that I think that also speaks to some of the complexity of being able to deliver services. And so could we be doing a better handoff between our partners, we're very jurisdictional, and so do we do better handoff with our partners outside the jurisdiction? And we'll put it another way, is it a smaller pill for us to swallow if we really charge the focus on our residents in the county and then make a better handoff to those in our neighboring jurisdictions to take care of them?
And not to dive too deep into the provider data in this meeting, not to be specific to anyone in particular, but I think it's very interesting looking at some of the data where cases are coming from. This is almost intuitive, but it's interesting to see. It's not just the areas immediately surrounding those providers. And I think that everybody here who's a provider can speak to that. But again, there's a high number of these that are located within the Towson precinct. That doesn't mean that that's where you are getting majority or even plurality of people coming to, right? So if you, and that's also the as big as Baltimore County is, about 695 running all around it. So you're going to have, based on where someone works, where someone goes in, takes their kids to school, that's going to impact where they go for services, and just also even knowing who is where, right? And then what you find if you just do a quick Google search or your interaction with the department, and that's going to impact where they end up for those services. So it's not necessarily a one-to-one family crisis centers in Dundalk area. It's going to only receive people from the Dundalk and Essex precinct requesting services. It's going to be Baltimore City. It's going to be other areas too. So.
There is a little back end element to this too. Each precinct has a domestic violence coordinator. So they will follow up on every domestic that comes through, ensuring resources, protective orders. They do all the gun checks or gun releases, one protective orders are out.
So why can't they serve a protective order like that? I mean, I don't know if I do your
Sure,
job.
Monday
Do
through
you
Friday.
do that?
I mean, that's an option.
Like, could
I don't
they-
mind exploring that. I don't mind.
They, from time to time, do when they're available, or if there's a special circumstance that does happen. But that's rare. And, when we have more resources, it happens more often. Our resources are less.
I mean, and I'm sure that's probably the main problem, is there just aren't enough.
So they got to grab somebody to go with.
Yeah.
Yeah. And is there one individual per precinct handles that, or is it weighted by?
Yeah, it's one per precinct. They have to remember they work, and sometimes the incident, depending on the time of day the incident happens, it actually comes out whether that person be available.
Right.
And they pick up other responsibilities too. When outreach needs a hand, there's a door.
Thoughts or questions? Now, based on this conversation, and also just based on discussions in prior meetings, my thought would be for this next meeting to look at some of the provider data as well as the State's Attorney's Office data, which Scott's team's been very forthright about. I think looking at that overlaying at the same time in the period we have here, just to get a sense about that next step. But we're still formulating that. And also, but I think genuinely I'd be very interested in hearing what people at this table, people online would like to see us do. My goal has been to make sure we're reflecting what the members of the working group want to see and not saying, oh, here's the best way to do it, because I'm not in the field. I'm not working with survivors day to day. So I want to make sure that we're making the best use of our time and our resources here to move the ball forward. So if anyone has any thoughts about next steps, I'm happy to make that happen.
I agree with you, Henry. I think you look at the additional data, whether it's from state attorney and individual providers, look at all their information. And then once we have all of that together, then we can start to map it. And we can get it down to even more micro level, where we can even focus even more closer on those specific neighborhoods and those areas where we really need to focus. You can pinpoint.
And that would be great. I think that's a good goal too, because we have a lot of data available. And part of the hope of this working group is to put it all together and out of the individual silos. So, great, Chief.
Is the ultimate goal to land on recommendations for moving forward?
That would be, and that's, Amanda, that's a good thought. My hope would be that by the end of the year, sometime in December, I think we'll do, now that we're coming out of the summer months for our next full meetings, potentially move to a monthly model from every 2 months. And I think this is something to keep in mind, is to think about what recommendations to make to the council and executive, and anything that our state delegation would like to take to Annapolis as well. Obviously, that's fantastic too. So that's something to keep in mind. I mean, I've been sort of tracking internally what points have come up in the last few meetings that have consistent themes. I mean, one of the big ones being housing and the availability thereof, and that or lack of availability thereof. One thing that's come up, I'm not sure how to kind of standpoint recommend it, is cultural competency and the variations between different communities in our county, particularly New Americans as well, and how to make sure that there's appropriate outreach and that it's effective. But I would recommend any member, if you have thoughts about what you would like to see. I mean, there's no requirement to come back with that, but it's always helpful, because then that also can reflect what we then look at. So if in the next week or two, think, okay, I think this would be great help, you send that information over to me, we can begin looking internally at ways to find data to dig deeper. Because again, I'm here to help make this work, and to work with the folks here in the county who provide that information or who are already doing the work in some cases.
Is there an asset map of, I like on the, that you show where the programs are, on the precinct map there. But does Baltimore County have a broader asset map of, say, where the additional shelters are and where the other hospitals are and some of the other partners and handoffs and places where, that are involved in all this, to both, I think, be, an external referral source, but also even look where the police, where the courthouses are. I mean, a couple
You
pieces.
can look at doing additional overlays on that, because again, it's simply a matter of getting the address.
Popping it in.
And yes, I actually don't know how to do it,
But someone knows. Sure.
people who are well above
Yeah.
me.
Yeah,
That may do.
it's something that we can incorporate at the next meeting. If we have a list of specific things that we want to see on a map. It's something that we can consider. And hi, Joy Roberts, Chief Policy and Implementation, PC staff.
Yeah, I think that would be actually useful information to have, because again, for anyone else who's visual, helps be able to just place these assets and resources where they are.
And I just have a question, and maybe this is a offline conversation as well, but maybe it's beneficial for this group, is I know we are, I think it elevates the intersections and some of the root causes that results in these outcomes, but it makes me also wonder from an internal process. So you mentioned that there's a DP coordinator. within the precincts. There's one in each precinct. What does the interdepartmental processes look like? Is health involved? Is housing involved? Is social service, like where, from the Baltimore County standpoint, and even I know our providers, you all work with a variety of folks across the county to better connect and coordinate here. And so it just makes me wonder, what do our internal processes look like at a county level? How are you engaging, or how is the DB coordinator engaging not only with the external providers, but what does the internal process look like? And does that then lead to other recommendations so we can, make sure that everyone is sitting in the room together so we can better utilize, coordinate, and, we love siloing each other. But it just seems like there are some opportunities for better horizontal integration. It seems like.
I can try to address that, or I don't know if the chief was ready to discuss. Can I?
Mark, you can have, but I was going to just let her know that the providers work, they're sitting here, but they work hand in hand with the PD coordinators. I haven't been out there with them for a while, but I know I actually was an outreach sergeant and an outreach lieutenant, so I supervised the operation. And I know when I was out there, they work together daily, together very closely. I would hope that they still work that closely together.
And Turnaround has one of their workers embedded with the sexual assault police department. They're every day, they're embedded.
Yeah. And I was thinking more of like, while our police, I'm thinking about other departments within Baltimore County, our agencies.
Yeah,
How
so,
does it look like internally there?
so I can address that. So I think you're asking sort of from a structural level. So the chief mentioned sort of operationally how it works. From a structural level, the county has a criminal justice coordinating council. One of the standing committees under the CJCC is the Domestic Violence Coordinating Council. So that group is comprised of a bunch of service providers, as well as both internal and external to government. So the nonprofit providers and the government entities that are involved in the work are part of that Domestic Violence Coordinating Council. They then have numerous subcommittees that do different work. But that's sort of the governing organizational structure. The DVCC reports out every month at the CJCC meetings about what's happening with work within the DVCC. The provider, there's a providers group. I can't even remember all the subcommittees that are part of that DVCC, but that structure exists. I'm not saying it's perfect, and I think there's probably a lot more work we can do to strengthen that, but that structure exists to allow for, I think, what you're asking about, which is the collaboration between internal and external government and community-based partners to identify what the needs are and work towards a more seamless service delivery system.
Thank you. I just wanted to know what we had in place. I do appreciate it.
Any other thoughts or questions or ideas?
So one of the, during COVID, Turnaround worked with 4 other victim service providers throughout the states to develop best practices. One of the resounding things that we heard from survivors beyond Baltimore County was that the warm handoff piece is the thing that's lacking, that and the place where they're most often falling through the cracks in terms of additional victimization, different victimization, heightened levels of abuse. I do think, to the delegate's point, I think it'd be really interesting to explore what relationship building could look like between all of us. Yes, we absolutely have a lab coordinator. We have someone at an SVU, and I think those relationships have been incredible because I actually have, in real time, as a survivor comes in, they can meet with someone from Turnaround as soon as they walk through the door. And so I think that if there's some way for us to build that relationship so survivors actually do get that connection piece across different organizations, that would be incredible. And then the other thing I wanted to point out, and I know this might be less helpful because some of the providers don't work with human trafficking or sexual violence survivors, but it would be really great to see this data with that information as well. Where are we seeing that? I think with trafficking in particular, like our numbers have gone down and it's somewhat startling, except for the child numbers. And so we're trying to figure out where those folks are so we can make sure they get access to services.
Are you in terms of victims and arrestees?
So I don't know.
It's like this data, but for that.
Yes.
Okay, I think.
Trafficking is hard. I know
Yeah.
because CJIS codes are very wonky when it comes to trafficking. I tried real hard to fix it, but
Useful. Anything else? Well, I appreciate everyone coming today. I know I really did focus on this one area, but I thought it warranted its own discussion and not to put it across paths with other data and other information. But yeah, like I mentioned before, in terms of what we're looking for, we're looking in early September to look at the additional data that kind of builds off of this and would help us, as the chief mentioned, get a better idea of beyond just the criminal side, where the high level of demand is occurring, where survivors are, and making sure that we're meeting them where they are, and services are reflected once needed. And also looking at, again, what's happening on the prosecutorial side of it and building forward, looking at, again, we've already identified, I think, some of the issues. And I think Delegate put it very well that unfortunately, a lot of these do overlap with broader systemic issues that go beyond simply the purview of this working group, but I don't think that means we're limited in terms of recommendations. So I don't think that saying there are broader issues at play here, or we can't mention those and address those too. So unless anyone else has anything to add, we can wrap up for the day. And like I've said, those on WebEx, I will be sending out the PowerPoint. I'll be sending a digital copy to everybody who is a member of the working group as well. So feel free to take a look at that. Again, if you have any questions about it, come up later, feel free to email me and I'll make sure that the response over to you. And likewise, any thoughts for future meetings, please feel free to email me or call me. I think everyone has my information now. So reach out anytime I'm available to discuss.
I got one additional thought.
Yes.
Yeah, the appropriateness of having someone from schools here. So, you know, she mentioned kids, and that's something I'm very passionate about. And we talked about us really impacting domestic violence and the issues that come from that. We really need to reach down to that level where we need to identify, okay, where are the schools, where are the issues with the kids? How do we reach down that far to impact the problem there so that we can.
And Chief, I can offer out to you about that as well. We did have a presentation this last time, but basically about kind of zeroing in on some things. All right. Thank you all. Have a great weekend. And again, thank you for making the time to